Welcome to my YouTube channel Sun Dental. I am Dr. Ashish Ranjan from Delhi. Today we'll discuss the 20 most common problems which I have searched, due to which most of the patients have to visit a dental clinic on a day-to-day basis once they encounter these kind of problems. These are the problems which can be avoided by you if you take care of your oral hygiene and if you visit regularly for your routine checkups. This can be minimized to a great extent and you can save a lot of money and you can keep your tooth healthy for a lifelong. The first problem is dirty tooth, where you get stains, calculus, plaques. If all these things are taken care on time, you will not spoil healthy tooth, the surrounding tooth. And the cost to do all these cleanings would be very less, like a peanuts. So all these 20 common problems, I'll be making a separate video for each in English as well as in Hindi. So as per the convenience, people can watch my videos. Second common problem is sensation of the tooth or the sensitivity of the tooth due to food or liquid, which can be anything. Third, the most common problem is tooth decay. Tooth decay also happens due to age factor. As you grind teeth, so the decay is there, and sometimes it is at an early age due to our ignorance, so those things can be avoided. The fourth one is enamel erosion. Again, this can be because of sometimes the enamels are very thin and we eat hard foods or which is very stiff, we bite, and those, due to habits, these problems comes. Then you have teeth grinding. Again, it's a habitual problems. So once you grind your teeth, your enamel gets eroded and then your sensation starts. Then we have gum diseases. Under gum diseases, you have inflammation of gums and other gums related problems, which we'll discuss in detail in our separate videos when we make topic wise topic. Then receding gums. Receding gum is due to, again, age factor thing. Then we have root infections, which I mean to say like RCT, where we require an RCT. For example, first the tooth will have sensation, then further it will go for a decay, and then further, if not taken care, still at that point of time, then still you have to, the nerves get inflamed, then grossly carious, pathological issues, then there we do root canal treatment. That is what I'm referring as root infections, cavity. Then you have dry mouth problem. This could be because of systemic problems. Mostly it is because of systemic problems. Bad breath. This is because of a lot of acid production in your stomach, so you have a bad breath problem. All these problems, if not taken care and if it progresses slowly, so finally you get a toothache, tooth pain. When finally a patient lands up to the clinic complaining about the pain, then you have impaction of teeth. This is a God-gifted kind of stuff where we generally don't have much role. Any people do not have. Suppose if 8 is impacted, so a lot of things depends upon your growth and family ancestors, how their jaw has been progressing. So there is a lot of scientific reasons in that. But yes, impaction of molars is the mostly, and canines impacted. Then we have cracked tooth. That again happens because if you are not taking care of your teeth and if it is fractured, and so that is called cracked tooth. Then we have crooked teeth. Crooked teeth is again a teeth which is not aligned, which can be corrected through ortho treatments. Then we have gap between teeth. This is again a problem which we cannot avoid. Like, it is not your problems, like it is not created by you. Then you have clenching or grinding of teeth. Then you have wisdom teeth problems, where the tooth has not fully erupted into the oral cavity. So a pericornitis kind of a stage is there, where some eruption is there, some is intact inside the gums, or an alveolar bone where food deposits happen, gums gets inflamed. Then you have pains, jaw opening problems, chick bite, all these problems are there. Then you have, sometimes we suggest for flossing, and when there is a compact, there is no space between the teeth. Jaw didn't have that much of space to flare up the teeth in terms of normal flaring up. Not I'm talking about a disease flaring up. So when you can't insert the floss, so there's a lot of congestions, and then if gum recedes, there is a food lodgement or seepages, and then further that leads to interproximal cavity, and so many things happen. So that is also again a problem for which you come to a dentist. Then chipping or chipped tooth. So these are the problems majorly what I encounter in day-to-day practice. So what I thought, let's educate our patients, educate our people. This purpose of making video is that this can go globally. A lot of places dentists are not available, or if it is availability is there, they have to travel a long way. At the same time, these problems, to some extent, majority of the problems can be avoided by a patient if they are made sensitized to it, if they are aware, and if they start practicing good oral hygiene, they can save a lot of money. So if you have liked my videos, please share. If you can subscribe also, you can share also, and we'll meet in our next video. Thank you so much.